Next, we're going to look at the medial structures of the elbow. Two structures we're going to look at is the ulnar collateral ligament that kind of runs somewhat obliquely on the elbow, and then the common flexor tendon. If we look on this screen here, we can see this is a trochlea. This is the subliminal tubercle of the ulna. There is a triangular structure, as you can see right here, as I'm tracing it out with my transducer. That is the ulnar collateral ligament. Above that area, in this regional area here, is the medial epicondyle of the elbow. So what we're looking for here with patients with elbow pain is either an issue in the ligament or an issue in the common flexor tendon, sometimes known as golfer elbow. Now, as I move the arm, as I straighten the elbow out, follow the arrow, and you can see the common flexor tendon insertion as it, keep your elbow still for me, there. Keep it there, don't move. And as I move it, you can see the top of the medial epicondyle, and generally common flexor tendon generally attaches from here to this region right in here. And you can see the common flexor. By having them squeeze your hand, squeeze me, you can see the muscle move and the tendon move. Again, unsqueeze, again, squeeze again, and unsqueeze. There you are. And that is an evaluation of the medial structures of the elbow. Again, you're looking at the area between the common flexor tendon. This is the more proximal part. And this is your more distal part. Remember that the medial epicondyle of the elbow is a lot smaller than the lateral epicondyle. And if you're looking for if we're going in, and then we can see the structures of the elbow. I'm going to follow if you follow the area with the transducer, you're going to see the distal part of the ulnar collateral ligament attaching right there at the tip of right here at the tip of the subliminal tubercle. And that has a distal attach of that particular ligament. And we want to make sure that we see that to make sure that that ligament is definitely intact. Sometimes we can do a dynamic movement and see the width and measure the width of the opening. Again, there we are. You can see the distal part. It is intact in this elbow. Okay, from the ulnar collateral ligament, we go in the go into the ulnar groove, and what we will find is the ulnar nerve in the elbow. Notice this hyperechoic dark area. That is the nerve. Sometimes we can pick up the honeycomb, sometimes we can't. The elbow, assessing the ulnar nerve in the groove is best assessed with the elbow straight, and as you bring it into flexion, you can see what you're looking for is to see if the the nerve will sublux over the ulnar in full flexion. In this case, it does not. Again, let's try to keep that intact. I'm going to put the arrow in position here. This region up here is the triceps and triceps muscle. This is the small ulnar nerve that sits in the groove, the ulnar groove of the elbow. This is the ulnar here. And what we want to see, if there is a subluxing, sometimes known as a snapping nerve, this nerve will go over, I call it going over the mountain, will go over the ulnar to the other side. It will follow this trajectory. So let's see if he has one. If he doesn't, the nerve should just probably stop right in this regional area. So I'm going to put the arrow here, hopefully that this nerve is normal. So as we move up, as we can see the nerve, you can see the nerve right there where the arrow is, right there. So that's in full flexion. So at 90 degrees, there is no snapping nerve. So that nerve is intact within the ulnar groove. We can also assess the ulnar nerve inside the groove in the long axis. And what I want you to do is to take particular note of this hyperechoic area right in here. That is the nerve as it sits into the groove. You can follow it up a little more proximally. And as I go down distally, we're going to lose it a little bit. You're going to see that we're going to lose a nerve just slightly as we go through the elbow. And then we're going to pick it up again a little more distally. And the nerve is picked up. A smaller branch of it is picked up just at the distal end of the ulnar. You can see it coming in right in this regional area here. It's a little hard to see, but there it is, right there. Now you can see it. Now you see it picking up. I've got it now, and you can start seeing it drop into the forearm. There we go. That's it right there. You can see it. Again, you'll notice that all these movements are very small, and the understanding of anatomy and how that nerve works is of paramount importance.